Good morning, everybody. There were over 95,000 tests yesterday. Our testing rates continue to be high, but regrettably we did have a substantial increase in the number of cases in the last 24 hours to 8 p.m. There were 356 cases of community transmission in New South Wales, and at this stage we understand around a third of them had some exposure in the community during that time. Tragically, there were 3 deaths related to the Delta strain overnight or until 8 p.m. last night, and of course we extend our deepest heartfelt condolences to all the loved ones of those 3 patients. One was a man in his 80s, one was a woman in her 80s, another was a man in his 70s. None of the 3 were vaccinated and all 3 died in hospital, and Dr. Chant will explain those circumstances. There was also an additional death, but that was resulting from a returned traveller from overseas, and again, our condolences to his family. That gentleman was in his 80s and we understand taken straight from quarantine, overseas quarantine, to hospital, but he was not related to the current Delta outbreak. Of course, regrettably, Canterbury Bankstown remains the central area where COVID is spreading, where the cases are increasing, and we have seen stabilisation and substantial decline in areas like Fairfield. So communities that are responding to the health orders and responding to what we're asking them to do are seeing a decline in their local government area. Pleasingly, there are no additional cases in Armidale, no additional cases in Tamworth, and the North Coast is investigating one potential additional case, but that's not linked to the gentleman that was in Byron. So Armidale and Tamworth, no extra cases at this stage, and potentially one other on the North Coast, but not related to the gentleman in Byron. Hunter has continued to have additional cases, and Dr. Chant will provide further information on request about those. Can I thank all the HSS students that came forward to get vaccinated yesterday? That was definitely a green shoot, knowing the young people came forward enthusiastically, nearly 3,000, and I understand we have the same number today. And I understand we have around 10 or 11,000 HSS students who've already booked for their vaccines. And can I encourage all those others who haven't to please do so? It's really important for those who are sitting the HSC exam in those local government areas of concern to make sure they have the vaccine, they're fully vaccinated by the time the exams come around. Again, we know that New South Wales is going through these challenging times, but we also know that vaccination is a key tool in reducing the spread and preventing hospitalisation. And it's always so sad when you hear about deaths, especially of elderly people who unfortunately, for whatever reason, weren't vaccinated, because that is proving to be an ongoing challenge. Those who have had 2 doses of vaccination have so far avoided any ICU, any mortality, but unfortunately those that are unvaccinated of any age, continue to be vulnerable. And with case numbers where they are, unfortunately, if you live in those local government areas of concern, there is a high chance now that you could get the virus. Please protect yourself, your family, your loved ones, your community by getting vaccinated, whether it's through your GP, whether it's through the local pharmacist, whether it's through one of our New South Wales health clinics, whether it's through your local place of worship or community centre if there's a vaccination hub near you. Please come forward and get vaccinated. This is the time to protect yourself and your family and your loved ones. And can I again issue a plea to say, if you want to get back to work, if you want to get back to normal life, please get vaccinated. Vaccination is key to what we can do potentially in September and October, and I look forward to seeing those vaccination rates continue to go up. I assume that by today we're at 4.5 million already, and I'd like to see us get to 5 million by the end of next week. And then look forward to having the sprint towards 6 million by the end of August. Dr. Chant will now provide the health update, and then of course we'll take any questions. Thank you.
Thank you, Premier. So there's 356 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 4 cases, overseas cases. Clearly, we are still seeing people infectious in the community, so a clear message is every time you leave your house, assume you're coming into contact with someone who's potentially got COVID. It is sad that we've announced additional deaths today. There's been notified of an 80-year-old gentleman from southwestern Sydney who acquired his infection as part of the Liverpool hospital outbreak. He tested positive on the 29th of July and he was not vaccinated. As part of that Liverpool Hospital outbreak, we have 7 staff and a student nurse and 29 patients impacted. And there have now been 6 deaths associated with this outbreak. Can I just say that New South Wales Health and the staff at Liverpool Hospital extend their sincere sympathy to the families and friends of these patients. And the death of any patient is felt deeply by the healthcare professionals who care for them. And a situation like this is tragic for everyone. The exposures occurred on a geriatric and neurology ward, and these patients are receiving the best possible care. But sadly, many are older and have health conditions which leave them very vulnerable to the harmful effects of COVID. Staff at the Liverpool Hospital are providing care and support for these patients in extremely difficult circumstances. The hospital is one of the busiest in the state and continues to take every measure to keep the patients and staff safe during the current outbreak, while continuing to provide high quality care to the community. There's also a lady in her 80s from southwestern Sydney died at Liverpool Hospital, and she tested positive on August 4th, and her infection was not related to the Liverpool Hospital outbreak. She was not vaccinated. A man from Western Sydney died at Nepean Hospital. He was in his 70s and he tested positive on July 7th, and he was not vaccinated. And then a man in his 80s from northern New South Wales died at Royal Prince Alfred Hospital, and he acquired his infection overseas and is not linked to the current outbreak. And he was also not vaccinated. In terms of an update on the situation in our regional centres, there's been no additional cases in the Byron, northern New South Wales area in relation to the case I spoke about yesterday. We had a gentleman and 2 of his children test positive, and there were a number of exposure sites. We have had no further cases linked to that exposure site, and can I thank the community for coming out for testing. There's been no additional cases in Tamworth or Armidale, and again thank the community for their response to the testing. We have had additional cases in relation to Newcastle, and there are a number of exposure venues that have been placed on the website for Newcastle. Again, thank you for the Newcastle community for coming out for testing in such high numbers. I do just want to also mention that we have had a confirmed case at the St George Aged Care Centre in Bexley. A confirmed case in a staff member worked 1 shift whilst infectious on 1 level at the facility, where 4 out of 8 residents have tested positive, and all 8 of the residents were vaccinated, and the staff member had received their first dose of vaccination. So appropriate care is being provided. Can I just echo the Premier's message about vaccination? We have high quality vaccines available to us in Australia, and it is incredibly important that people take up the opportunity to get vaccinated. It's important to get that first dose, but it's also important to complete your course. So we've been providing guidance, and that is consistent with the advice of the National Expert Advisory Group on Immunisation called ATAGI, that says in the current context, bring forward your second dose of your AstraZeneca to anywhere between 4 to 8 weeks. So if you have had your AstraZeneca vaccine in that period, your first dose, please bring forward your second dose. And as the Premier has also indicated, there's increasing access channels through pharmacies and general practice, and I urge you to make a booking to get your vaccine. Thank you.
Premier, given that cases are continuing to rise, given that we are going backwards here, do we now need to see a ring of steel put in place, a curfew put in place?
Firstly, can I say the New South Wales Government will always consider options which will reduce case numbers. But it's really, really important to make sure that any step we take is going to have that impact. And I might ask Deputy Commissioner Warboys to speak about the additional police work in those areas of concern, which has seen greater levels of compliance as a result of that presence. And Deputy Commissioner Warboys, I might ask you to comment on that.
Thank you, Premier. Good morning. Additional police still operate in the southwest and northwest in ADF as well. So just in the last 24 hours, over 1,000 compliance checks just in that southwest, that LGA area of concern with police and ADF. It was only yesterday that they found 2 people that were meant to be inside a house that weren't there. Those people were located, and health are advised and they'll return to where they should be. So those compliance checks are working, they are having an impact, and we'll continue to task ADF and police additionally to the local resources to those 8 LGAs. In the north of the state, in the last 24 hours, over 400 vehicles were stopped by police specifically for those breaches that might be occurring in and around the public health orders and people travelling without a reasonable excuse. 17 infringement notices were issued and 7 vehicles were turned around and sent back to locations where they came from because they had no reasonable excuse. It's a challenging time, not just for the community, but for police. But New South Wales Police won't back down in their endeavour to make sure that people comply with the public health orders right across the state. Particular emphasis in those 8 LGAs, for sure, those 9 LGAs and into that Canterbury Bankstown area. But let's be clear that right across this state there are now risks and threats with people that breach public health orders, and the police have specific operations in each of those areas to make sure that people comply and put us in a position we can best get through this challenging time.
It's now 7 weeks in. The numbers continue to rise. They are bouncing around. But what is it going to take? What are you waiting for to pull the trigger and further impose more restrictions, like a ring of steel, like a curfew? What is it going to take?
I think what we also have to accept is the basic fact that Delta is very different to other strains we've had. So policy positions that may have worked in the past aren't going to have effect with Delta. And that is something we need to accept. We need to accept this is a different variant and you need to approach it in different ways. And can I just finish my sentence on that one? So in relation to that point, based on the health expert advice, vaccination reduces your chance of spreading, it reduces your chance of landing in hospital, and it reduces your chance of dying. That's why a targeted approach in those local government areas with our vaccine strategy is absolutely key to seeing us maintain and reduce those case numbers. Please know that had we not been in this difficult lockdown for 6 or 7 weeks, the case numbers would undoubtedly have been in their thousands and thousands every day. That is no doubt about that. But there's also no doubt that the Delta strain is different to other types of COVID we've had in Australia, different types of COVID we'd have to deal with in New South Wales. So your approach has to be different. Fortunately, we have the tool of the vaccine we didn't have before. Lucy was next.
You've had advice that a ring of steel, a curfew and further restrictions will not work because it's Delta, and therefore this is, you've been told, the health advice is there is no further we can go on restrictions.
Oh, look, if the health advice suggested to us there was further we needed to do, of course we would do that. But we also have to accept that part of the challenge we have in New South Wales is because of lack of compliance. Part of the challenge is just because Delta is very, very different to anything we've seen before. And part of the challenge is, of course, having people accept, a small handful of people accept that this is serious. Unfortunately, there are still pockets of people who think that this is not a serious illness, who don't believe that they need to follow the health orders, and that impacts everybody. But moreover than anything else, it's the way this virus spreads and the way the virus moves. And can I assure you that short of not having authorised workers do what is necessary, it is really difficult for us to get to lower case numbers without that targeted vaccine strategy.
Given that, will you admit that New South Wales won't be able to get down to 0 cases of COVID infections in the community, and we are relying on increased vaccines not getting case numbers down? Will you admit that?
Well, the New South Wales government has always said that our strategy is to get to as close to 0 as we can to those cases infectious in the community. But regrettably, we've seen those numbers increase in the last few days. But that is the binding principle which National Cabinet has to follow. However, we have said in New South Wales, as I've said continually, that higher vaccination rates will give us additional freedoms. There is no doubt about that, because what we need to prevent is people ending up in hospital. And one positive aspect of the last few weeks is confirmation that vaccination prevents people ending up in hospital. Vaccination reduces the spread. So a targeted vaccination strategy in those local government areas of concern is key to us moving forward in New South Wales, and key to us having greater freedom, and key to us making sure we hit those vaccination targets. Now, getting to 6 million jabs by the end of August will give us some opportunities in September, and we're looking forward to that. And obviously we're taking advice from our health experts and others across government to see what September and October look like. But let me assure you, the New South Wales strongly supports what was in the Doherty report, and that is having all states have to abide by a code which says you have strong suppression strategies in place until you get to 70% double doses, and that is certainly our
Premier, in regards to, you just mentioned targeted strategies. In regards to Canterbury Bankstown, you've said repeatedly it's the epicentre. Are you willing to consider a hard lockdown for Canterbury Bankstown or selected suburbs there? And if there is a reluctance, is that because there is a fear that there'll be a backlash and you'd be accused of xenophobia, for instance?
Please no. I ask people to look at the facts as to how harsh the lockdown is in those local government areas. For example, other states had an authorised workers list going to 17 pages. The authorised workers list for those 8 or 9 local government areas is very short compared to what other states had. But the different point is the Delta. When you have a virus that is that contagious, and when you have an unvaccinated population, that is the threat of Delta. And strong suppression in New South Wales has worked to the extent that we don't have thousands of cases today and we don't have hundreds and hundreds of deaths, which other strains of COVID provided, unfortunately, on Australians. We managed to avoid those, but Delta is different, and we need to treat it differently. And the New South Wales government doesn't have any intention of putting in strategies that aren't going to work. What we do need is to make sure we have greater compliance, and the police know, and they're providing us advice. They're working with the Australian Defence Forces on a daily basis in ensuring compliance. And day to day we get updates on what those compliance activities are demonstrating. But we also have to accept that when you're allowing critical workers, whether it's in aged care or providing food services, to venture out of those communities with high rates of transmission, you need those high rates of testing, but you also need those higher rates of vaccination. And that's why we're keen to provide any incentives we can to people in those communities to get vaccinated. And it brought me great joy yesterday in what has been a very difficult couple of weeks, and will be for the next few weeks, great joy to see HSC students come forward and get the vaccine. And they're the type of strategies in those key local government areas we need to continue to adopt to make sure we reduce the spread and make sure we reduce reduce the rate of people being hospitalised.
Premier, it's going to be a courageous decision for you when we do get to 70 or 80%. With this much Delta circulating in the community, to significantly relax restrictions or relax restrictions of any consequence. Have you got a metric as to what numbers you'll be comfortable with in terms of community transmission, rather than just the glib line about as close to zero as possible?
Well, the Doherty report provides good guidance for all states in relation to what you can do at 70% and 80%. And we know that at 70% we'll have enormous opportunity. When you know that 70% of your population, especially in some of those key areas where the virus has been circulating, if 70% of your population is vaccinated, that gives you enormous opportunities to allow your citizens to leave much more freely than what is occurring now.
But with that much Delta in the community, I suppose my question is, does that offset any decision you might make around what the vaccination rates are? Because that's still a fair chunk of the population who aren't vaccinated, and that could have serious consequences of people going into ICUs and the like.
Well, this is why we've had a sense of urgency in New South Wales about the jab, and why we're keen to see at least 6 million jabs delivered by the end of August, because that does give us opportunity as to what people can do in September and October. But it's really important for us to make sure that we provide the vaccination, a targeted strategy in those areas of concern to reduce the spread, especially amongst key worker groups. It was pleasing to see a couple of thousand people come out on Sunday who worked in the food sector. There'll be another one for construction workers this Sunday, I understand. So it's really pleasing to see people want to work, people want to get out, and they're coming forward and getting vaccinated. Who hasn't asked a question yet?
Premier, just in terms of easing restrictions and opening up, what are you going to do and say to parents with children? Because obviously there's going to be children moving around, they can't get vaccinated, younger children. aren't you exposing kids to this virus because they are getting Delta?
Can I assure the community the New South Wales government never has and never would take decisions which impact the safety of our citizens? Quite the contrary. We're always top of mind thinking about the safety of our community. But having said that, higher risks of vaccination amongst adults gives you opportunities to do things a bit differently in September and October, and that's what we're looking forward to. So we're not about to make any decisions that aren't going to keep communities safe. Quite the contrary. The reason why we have a strategy to vaccinate Year 12 students in those local government areas of concern is to make sure they can safely sit for their exams and make sure they can get their HSC requirement. Can I please say, I know, but I'm just using that as an example. So can I please say in particular to Year 12 students, please know that you will be able to sit for your exams and attain your HSC, and more broadly when it comes to decisions around school and education and young people, that we will follow and take the health advice as we always have. But we also do know in particular demographics and populations where the virus is particularly impacting, and we know that in adults it's impacting people who are mobile, people who aren't vaccinated, of any age, and they are the decisions that we'll have moving forward around what is a safe way to live in September and October. But we would never ever risk the health and well-being of our citizens. We've been very clear about that. But we also have to be very upfront about vaccination being a key tool. And anyone who thinks vaccination isn't a key tool in dealing with Delta, unfortunately, isn't listening to the facts and isn't listening to the health advice. And it's very important for us to make all of our decisions based on the health advice and based on the facts and based on what our populations need moving forward.
We've got spread to the regions. You've got a rule that says people can travel to go and look at real estate, people can travel to their second home, and I've heard of people going to and from their beach houses. Isn't it time we had a much tougher rule around travel to stop spread to regions where they're going to be more vulnerable? The hospital system isn't as strong.
Yeah, I'll just ask Minister Hazzard to address that issue, but I just say at the outset that people know what is right and what is wrong, and we expect people to do the right thing. But Minister Hazzard's been looking at that issue, and I'll just ask him to comment on that.
Thanks, Brian. Thanks, Anne, for that question. Look, I think the issue is that it is difficult in regard to houses in different areas, but examples would be, for example, if you had a doctor who lived in Sydney but also went to somewhere in the regions for 3 days a week, 5 days a week, if you had and had a house there, if you had, for example, a family split up and one of the partners wanted to move and has to look at a house to find accommodation to take, for example, her children or his children. So it is challenging. Having said that, I've said to our legal department to look at what we can do to tighten it up as far as is possible. Clearly, the rule is now that you shouldn't just travel from one house to another just for the sake of moving to the other house. You should choose the property you're living in and stay there. But what does worry me, I have to say, is no matter what legal orders or what legal requirements are in place, you can't legislate against stupidity, arrogance and entitlement. People will still try and do it, which is why the Premier's made the point that we've asked in the epicentre at the moment of this virus, that is at Canterbury Bankstown, for the police to reinforce the existing rules. If people just applied the rules, if they complied with the rules and the law, and they applied an element of common sense and a modicum of decency to the rest of the community, we would be fine. But
what was that bloke's go that went up to Byron Bay?
Sorry, Chris.
What was the guy's go that
I'll
went
go
up
with
to
Chris first. Sorry.
Yeah,
okay.
can we just discuss what happened?
And sorry, that's the answer because he's moved on. Yeah, sorry, Chris.
The fellow that went up to Byron Bay, what happened there?
Yeah, well, all I'm prepared to say about our traveller to Byron is that the police are looking extremely closely at what he was doing in that area, and I trust the police will be able to take appropriate action in due course.
If he was going to inspect the property, though, Minister, if he was going to inspect the property, that's illegal. So,
as I said, there are matters where one has to be a little bit cautious because I'm not going to prejudice either the police investigations or the police actions, but I'm certainly hopeful there will be both.
Nefarious activity.
Cooperating with authorities? Is he not cooperating with authorities,
Sorry, can
Minister?
I do Chris first?
Saying this potentially nefarious activities.
I think, Christopher, I've said all I'm prepared to say on that matter. Yeah.
Is it the case
You can draw your own conclusions, but I'll say again, you know, we've got, as the Premier has said, we have the strictest of orders in New South Wales. If people just stuck with what they were asked to do, this Delta virus would be finding itself being beaten back into submission. But the fact that people are just ignoring the rules, and I have to say, being fair about it, I think probably something in the order of 90–95%, a very high percentage of people are complying. And we're seeing that in places like Fairfield. They've made such a difference there and brought the numbers down to such a low level. I want to thank the people of Fairfield. But there are other communities, other people from other backgrounds who don't seem to think that it's necessary to comply with the law and who don't really give great consideration to what they do in terms of its impact on the rest of the community. And I would say to them, you really need to, because otherwise the forces of the law are coming after you.
Is it the case that he's not cooperating with authorities,
go here
Minister?
first and come back.
Is he not cooperating, this gentleman, is he not cooperating with authorities? Is he not telling them where he's been? There's been reports that he's not a believer in COVID as such and therefore is refusing to cooperate. Is that the case?
As the former Attorney General in this state, I'm very conscious of the fact that when police are undertaking investigations, we should allow them to take their investigations and not prejudice those investigations. And hopefully any activity that might have been inappropriate or illegal will be dealt with by the police and the courts. Sorry, Ursula.
Is he cooperating with health though? And did he try to leave hospital last night, we understand?
I'm not prepared to comment except to say that every individual should comply with both the health. You know, when health asks you questions, it's doing it to try and save you and your family and your friends and your community. So the answer is you should actually be very open with them. And as to police, well, if the police have come after you, it's for a reason generally. At that point, all I'll say is that we should leave the police to their investigations. Sarah, I'll just do Sarah because Sarah's the last one. Yeah, Sarah.
Is it frustrating that you don't know where the COVID exposure sites are? So you've got North Coast communities in the dark, not knowing whether they're close contacts. And also, why was the North Coast put into lockdown with only 1 hour notice?
Sorry, where? North Coast?
Yes.
I'll come back to that. But just say, look, I think we've been on this journey now, all of us here in New South Wales, for 20 months. And Delta is an extremely dangerous variant of the virus. It's wreaking havoc across the world. Here in New South Wales, if people would just, a small element, a small group who have caused these problems, if they would just behave themselves and have an element of decency towards the rest of the community, we would sort this problem out. The laws are there, just comply with them and we will get through this. Sorry, and
because we didn't know where the exposure sites were and we didn't want to take the risk.
Yeah, no, thanks, Sarah, for that. Look, the challenge is always to try and know when to respond to risks in any part of New South Wales. Sometimes Dr. Chant will raise a flag and say that we really need to look very closely at this area. And we will talk with her, I will talk with her, the whole team will talk with her. We'll talk to the other elements of health, such as when we make a decision like that, we also know we have implications, operational implications. So, for example, if we declare an area as an area that's going to go into lockdown or an area of concern, we can expect that there'll be a lot of people who will do the right thing and come out and want to be tested. So we need to make sure that we've covered off on all of those aspects. But at the end of the day, when we've weighed all those things up and we think there's a real risk, and sometimes the risk comes from the unknown, and sometimes you weigh up the particular person or persons that you're looking at in terms of the circumstances. And if, for example, I'm not indicating that this is the case, but if, for example, we were dealing with someone who was not cooperating and not giving us the information we needed, then you could imagine that the government would move more quickly in that situation to make sure we lock down as fast as possible to keep safe. Can I also say that in any of those situations, in regard to the Northern Rivers, we also talked to the local community representatives. So I spoke to each of 3 MPs up there as well as others, and they are across the political spectrum, completely across, and they were very, very keen to see their community safeguarded by moving to a fast lockdown. So I think that explains it sufficiently, doesn't it, Sarah? Can I just finish with, and then we'll do
National Cabinet agreed that
and then Dr. Chant, that's right.
all aged care workers, National Cabinet agreed that all aged care workers would need to have one vaccine dose, at least one vaccine dose, by September.
Yeah, that's right.
The federal government...
Mid-September, I think it was. Yeah.
The federal government says that no state or territory, including New South Wales, has put in place a public health order to enforce that vaccination requirement for aged care staff. What's the hold-up? Why haven't we done that yet?
Well, first of all, I don't know that that's been a requirement by the federal government. Not sure whether
it was an agreement
the federal
made
government. Look,
national
seriously, the federal government is responsible for aged care, and if they want to ask me to put in place an order for that, I will, and I may also look at it. But can I tell you, the issue is, at the same time, there's a lot of discussion going on in the community about mandatory vaccinations. And I think that needs to be sorted through. Certainly in terms of the federal government, they need to make sure that the area they regulate is actually getting what is needed, and they need to make sure that the vaccines are getting to them as well. We've had to step up. The New South Wales government has stepped up to assist the federal government in getting vaccinations for aged care workers. You might recollect that originally the federal government said they would address all of that, and they vaccinated a number of residents in aged care. They didn't vaccinate the staff, and I guess that was a supply issue, but I'm not sure why they didn't when they had people on deck at the aged care facilities. And I understand they've now agreed across the board that they will do whatever they can to try and get staff in the aged care facilities vaccinated with the first dose by the middle of September, and we are certainly supporting that. If any of the aged care workers, we've made it very clear, any of the aged care workers want to come to our hubs, New South Wales hubs, we will vaccinate them. They will be vaccinated. So we're doing everything we can to assist them. And if at some stage it moves to the point where we have to put an order in place, and that's something the federal government wants us to do, we'll do it. But that's well off. I mean, mid-September is 5 weeks. I mean, they can tell us now. If they gave us that direction, I'd happily do it. But it's their facility, their regulation, they're responsible. Sorry, I'll go to... Oh, sorry. Can I go to Ashley and then I'll step back and let you take... Oh, sorry, Alex. Yeah. Sorry, Alex, I just missed
health workers making it mandatory for them to have 2 jabs.
I am of the view, as the Health Minister, that I would like to see all health workers in New South Wales vaccinated. But health ministers don't always get their way immediately. I have initiated discussions with the unions. I've spoken to 2 union leaders this morning and indicated that I believe that if you want to work inside a health facility, if you want to care for patients, you should be vaccinated, because this particular virus is extremely dangerous. And there are precedents for compulsory or mandatorily required vaccines in other areas. So I've asked New South Wales Health to work with the unions. As I said, I've picked up the phone and spoken to them as well. And I'm hopeful that we might be able to get to a point where there's a consensus view. But yeah, strong view. My strong view is that health workers they go into the business of looking after people because they care about them. And I think the majority of people in health will get vaccinated. Obviously, there have been some constraints around the vaccine supply, but most of them are on board. But even a small number is concerning, and we've seen some situations where obviously negative consequences have occurred. And we're here to look after people and patients, and that's what hopefully all health workers want to do. Ashley, are you finished with it? That's it? Can I? Dr. Chan.
The Premier said before that further restrictions won't work. The advice has come from you. Why won't they work? A ring of steel that...
So look, I didn't take that from what the Premier had said, but the Premier... Oh, sorry. I didn't take that from what the Premier had said.
The direct word was they won't work.
No, I didn't. I'm sorry, this is a very important point. I was asked about specific actions and why they weren't taken, and I said very clearly that if we need to do more, of course we would, based on the health advice, but we're not in the business of putting in provisions or asking people to do things if they're not going to have an effect in reducing the case numbers. Now, that is a very important point to make. We are all about reducing the case numbers, increasing vaccination rates, and we'll take any action we need to.
Specific measures,
but they have to be
curfews and ring of steel.
Right.
Your view is they will not reduce the case numbers.
Well,
I'm asking Dr. Chan why they won't reduce the case numbers.
In relation to those matters, if we thought that they would have a significant or even marginal impact, of course we'd do those things. But there is no evidence to suggest that's the case. I have every faith that the police and the Australian Defence Forces, who are working together on the ground, are taking all those necessary actions. Sometimes, as Deputy Commissioner Warboys has foreshadowed, they will set up. They will set up.
Going to Byron Bay.
They will set up checkpoints and various other things, as Deputy Commissioner Warboys already said. Police stopped. Turned around 7 vehicles yesterday. 7 times yesterday, the New South Wales Police prevented someone potentially spreading the virus to our regions. Thank you to the police force. Thank you to the Australian Defence Force for doing that activity. As Deputy Commissioner Warboys said, they prevented or tracked down people who should have been staying at home that weren't at home. Again, another example of boots on the ground, police doing what they need to do. So please know, if there are additional recommendations we get from Dr. Chan, of course we'll consider those and implement those.
Why then, Dr. Chan?
I'm sorry?
How are you going to turn this around?
Sorry, Premier.
People at home don't like it when you guys do that. Yeah.
So, Premier, you sit around Crisis Cabinet. Have you gone to Dr. Kerry Chan and the Public Health team and said, is there anything more we can do? And they've said, no, not at this point. People just need to comply with the current rules.
Not at all.
And we're really trying to understand.
Sure. Can I ask Dr. Chan to comment after I do? But the best advice we have from Dr. Chan, and she says it every day, is that vaccination is our key tool for us, as is compliance. I don't want to put words in her mouth. I'll ask her to say her bit, but certainly vaccination targeted in those areas of concern is a key tool we need to use, as well as heavy compliance activity in those areas of concern. But I'll ask her to address that.
So in general terms, we need to further decrease mobility, and the community needs to adhere to the orders. So we're still seeing a lot of unnecessary movement of people. We're also seeing compliance gaps. I mean, an example, when I was talking to one of my public health units, that they reported a case had a partner had visited close contact. These are not the actions that we want to see when we're dealing with a virus as transmissible as COVID. So for me, decreasing mobility, decreasing the opportunity for interactions, meeting those density restrictions, adhering to your local government areas if you're in those affected communities, and also for people outside not going into those affected communities. We need to do more if we're going to see these case numbers drop down.
But you're 7 weeks in and you're still talking about decreasing mobility. So what more are you going to do to ensure that people aren't moving around when they're not meant to be?
So that's where the police and the defence have really stepped up compliance activities. So every day we identify areas where we're seeing increased cases. So we have a huddle with police every morning, and we say these are the areas we're really concerned about. And so the areas I'm concerned about is Canterbury, Bankstown. And
is that a reflection that what's happening with the police is not working?
So there's the issue of the orders and what are the rules, and there's the issue of the community complying with those. Now, as I said, a large proportion of the community do, but a small proportion of the community don't. And that's not a simple matter, and it requires a sort of whole of government action. And one, it's to support people with food and access so they don't have to take actions to go to work when they're sick. It's about policing in terms of increasing compliance. It's also about working with community leaders to better explain. As the Premier said, there are some communities where we need to increase the understanding about the seriousness of COVID, how it's transmitted, and the implications. We also need to discuss vaccination. If there was a single silver bullet, that would be the case. But from my public health perspective, I'm not happy that these case numbers are increasing, and we certainly need to do all we can. But compliance will be one of those components of it.
Why is it your view that they will not have to bring case numbers down?
So clearly, my public health advice is we need to put in further further look at how we can stop people going into the regions. The police. Sorry?
Is that another way of saying a ring of steel?
So I'm not in the position to understand the operational impacts of how you would do it, and so that's been passed on to police, and police have put in an increased regime of compliance.
What about curfews? John. What about a curfew? Would a curfew help decrease mobility, at least by giving police greater powers to enforce compliance? And would a curfew, by decreasing mobility, have a significant or even a marginal impact on the spread of cases?
Look, I think the evidence about curfews is not strong, but I think what I'm concerned about is the crowding in shopping centres and places where we have seen transmission events in small shops. And so I've asked police particularly to focus on adherence to those density restrictions. I think I've repeatedly messaged about the fact that I really want people to be staying outside of shops and waiting outside and going in almost one at a time into shops.
Dr. Chan, at 7 weeks in, isn't it fair to assume that at 7 weeks in, if people aren't following these rules now, it's not going to get better? Fatigue is very well set in some of these areas. So isn't it fair to assume that we need to do something different? Is it increase fines for not complying? Is it the curfews? Is it the rings of steel?
So government's always considering about how better to support the community comply. And so I think the Premier has announced additional support and we've certainly provided funding to the non-government organisations to better support the communities through organisations such as Red Cross and others. And so those strategies will mean that there are less barriers for people doing the wrong thing. And I think the government is actively looking at a range of strategies.
Except it's not showing in the numbers though, is it? I mean, the numbers are staying so high.
There will be, once you've got that force of infection, it's really hard to turn it around. And that's why I think we all need to redouble our efforts. And I appreciate that those communities have been heavily impacted. But there is also the disease burden in those communities. And so I think we need to further work with those communities to really ensure that compliance, and as I said, it's a whole of government approach in terms of supporting those communities adhere to the public health advice.
Dr. Chan, can we just ask you, we're hearing that some contact tracers are taking up to 3 days to reach exposure sites, which is clearly an issue. Are your contact tracers under too much stress? And if you can just answer that.
Okay, so look, case numbers are increasing and obviously that stresses all parts of the system, both the operational health aspects of the system and our contact tracers. However, we have scaled, and I want to acknowledge the role of Defence in coming forward to help us as well as part of a team approach to contact tracing. But I just want to explain that the why that you don't immediately know about a venue is that a person gets a test, the test result might come back 24 to 48 hours later, and then you interview the person. And so obviously you take the 2 days before you find out when they've got symptoms. And unfortunately, some people actually have symptoms for a while. I mean, unfortunately, the reason we, for instance, announced the lockdown in relation to the Northern Rivers was because we knew that that gentleman was infectious in the community for upwards of 8 days, as was potentially the children as well. So they're factors. If we can have people coming forward at the earliest symptoms for getting tested, that will also assist us.
We are getting some reports of some people being contacted by New South Wales Health that they are a close contact of someone who's positive, but they haven't actually been to the venue that's been nominated. Is that an example of the
so there was an issue. There was an issue and an error, and I apologise for that this morning in relation to one venue in Newcastle where there was confusion over which site of the gym that was infected. That was corrected quickly. I do apologise if there is any errors. It is when you're dealing with a massive number, there is occasionally a miscommunication, but please know that we're working as hard as we can to get that accurate information out and doing all we can to support contact tracing.
Just on Newcastle, when will the decision be made on whether that lockdown is going to be?
Oh, well, that was a better question for Dr. Chant, but obviously we'll take the health advice on that. There are obviously additional cases today. As we provided advice on, pleasingly, Tamworth and Armidale haven't had any extra cases. North Coast could have one, but not related to the Byron person. So those 2 or 3 areas, at least the 2 areas, are looking positive. In relation to Hunter, there has been an increase in number of cases. I think it was 12 or 13 overnight. So we'll rely on Dr. Chan's advice on that. If she recommends an extension of the lockdown, that's what we'll determine. And if she determines that Tamworth and Armidale can come out of lockdown, well, then that's what we'll announce as well.
Dr. Chan, can you update us on how many...
I'm sorry?
sort of planning to get workers back
Yeah.
in the offices in the CBD. What sort of vaccination rates do you guys want to see before that can happen?
Firstly, can I say I've been heartened by various industries approaching government saying that they want to participate in a vaccination incentive program. So a lot of businesses do want to see and encourage their employees to get vaccinated and get them back to work. And so we'll be working with industry on our plans moving forward to let everybody know what September and October and November, for that matter, looks like. And I just want to thank industry for working with us so collaboratively and so constructively. And clearly, people do want to get back to work. And if vaccination's an incentive for them and their employer wants that, that is not a bad thing. It gives us greater degree of comfort to know that business and community and employees are working together to make safe places to work and also to make safe places for people to go. I wouldn't feel comfortable using a service or going anywhere if I felt people weren't vaccinated. But I would feel comfortable going somewhere if I knew that there were good rates of vaccination, a safe place to conduct activity. And I think business and industry appreciate that, and they're really, really keen and enthusiastic to get higher rates of vaccination amongst their employees so that we can provide them opportunities to recommence activity.
Could that happen at 50%, Premier?
Yeah, Deputy Commissioner. Dr. Chant just said that her public health advice would suggest that we need to look at how to stop people from going into the regions. What would be the police response to that? How would you enforce something like that?
I think the way that we get to that the quickest is that people abide by the public health orders themselves. What we are seeing is people making conscious decisions to go outside to contravene the public health orders at a risk to themselves and the community, and the whole strategy around getting New South Wales back to normal as quickly as possible. I've outlined what happened in North Region just in the last 24 hours, a significant police presence, Traffic and Highway Patrol, local police, our Transport Command, in pulling over vehicles and making sure that they had a good and proper reason to travel. Some of those were turned around, some of those were issued with penalty infringement notices. That effort will not only happen in Northern, but it'll happen in Western Region, it'll happen in Southern Region, and we'll continue to treat Greater Sydney in terms of its merits, where the transmission is, where people need additional efforts around compliance. That will happen, and New South Wales Police has shown that they are up to that task. It's reviewed every day at our Police Operations Centre that is working 24/7 on the police deployment issue. We're assisted by ADF. We are in a very, very good position to continue to ratchet up that compliance, that visibility, that policing effort to make sure that people comply with public health orders.
Were those two people fined that were in the wrong household? You mentioned stuff.
I'm sorry?
Were those two people fined? You mentioned who were in the wrong household.
Yeah, one was reported back to health in terms of their, their ability or their mental health to stay and comply with that order. The other is under investigation. I suspect a penalty notice will be issued and further action.
Mr. Hazard, just on the aged care stuff, this is obviously very important given that it is being introduced to nursing homes. On the 9th of July, there was a National Cabinet statement, the Premier was obviously present at that public health orders or similar state and territory instruments, just like influenza, would be used to mandate vaccines for aged care workers. That was a month ago, so you can't really say you didn't know about it when the Premier was there.
I'm not saying I didn't know about it. I'm saying that the federal government hasn't given us any direction at this stage of what they want in their aged care facilities in terms of the precision of it. Do they want it? Oh, there's a whole lot of legal factors.
Agree with the federal government that there would be a public health order that would mandate that?
Yeah, but the issue there is that we need to work through what the federal government actually want. At the moment, we haven't got that, but we will do it. We will do it. We've got another 6 weeks before it becomes mandatory, Chris.
Well, yeah, but with the greatest of respect, there's aged care workers right now going in with coronavirus, infecting people who are in nursing homes, potentially going to kill them. Like, how long do you want us to wait?
As I said, we will work with the federal government as to precisely what they want, and we will get that done as soon as possible.
You made the agreement on Premier. You made the agreement on the 9th of July in that statement that the state would put in place public health orders or similar to affect this.
But I've just answered that.
But why?
I've just answered that.
But the Premier was there, so I want to ask her.
Is there a fine for intentionally failing to provide crucial health information?
There are fines available for not being cooperative with the health inquiries. The challenge, though, of course, is that generally the health staff who are asking the questions are trying to do it in a way that draws out all the information in a compliant way. So health workers don't tend to threaten patients who have an issue. It's not what would normally bring out the information. So the police can then deal with other issues if they are breaching the orders. I mean, we've had examples, as the Deputy Commissioner was just saying, that we've had examples of, I'm just thinking of a couple of them, where people went from southwest Sydney to Newcastle and then from there went and spread the infection, well, the infection spread anyway, after they arrived there in Newcastle at the university, and then distributed itself up to Armidale and to Tamworth. My frustration here is that you'd have to be living under a rock not to know that we have a serious issue with COVID in southwest Sydney, and then to deliberately go to Newcastle or outside Sydney with no apparent reasonable excuse is just completely unacceptable. But that's the sort of thing we're getting, and it's enormously frustrating. I've got to say, I think the police are doing an amazing job. They do have, for example, a registration plate detection, and they can see who's coming from where, and that's causing them to be able to stop people. And there are, as you heard from the Deputy Commissioner, turning people around. And where there are clear breaches, then they take action.
Given that we clearly have a problem with compliance, why isn't the Police Minister and the Attorney General in the Crisis Cabinet, and should they be?
Oh, look, those ministers are, can I just say that Cabinet colleagues are consulted on an ongoing basis in relation to the areas of responsibility they have, and Cabinet meets, broader Cabinet, full Cabinet meets every fortnight as well, and of course there's ongoing consultation in those areas. So please know that as health experts, as Dr. Chant says, as Minister Hazzard says, this is a whole of government approach, and the New South Wales people can be assured that we do take that literally. We make sure that all relevant steps are taken to make the best decisions possible.
Just over 22% of business applications made through Service New South Wales have so far been paid out. 7 weeks in, why is it taking so long to get to all these requests?
Well, obviously, we're trying to get to as many requests as possible, and I understand we're hoping to deal with most of the backlog by this Friday. So I appreciate a number have received their grants, and can I apologise to those who've experienced delays or frustration. Please know that we're keen to get the dollars out as much as you are. We thank you for your patience, and please know that there's been additional resources, additional systems upgrade to cope with the demand. And please know, most importantly, that during a time when your industry isn't able to operate fully, or a time when you're not able to have a full income that you normally do, that the support will continue. And whether it's through Services Australia and the disaster payments for you as an individual, or whether it's through Service New South Wales and your business, that you will receive those payments and hopefully not be as stressed as you are at the moment.
The Feds are doing JobSaver, the administration of JobSaver through Services Australia in other states. We're doing it via Service New South Wales here. Should the Feds do JobSaver in New South Wales?
That was a request. That was an agreement, and the Commonwealth said they had confidence in us to do that and asked us to do it.
Misplaced?
Premier,
No.
with the allocated doses of Moderna and Pfizer on the way, when will you look to open up those vaccines for the 18 to 40s? And would you do it 30 and above first and then the younger cohort, or once you've got enough vaccines you'll open it up to the rest of the population?
Well, obviously we're taking health advice in relation to the supplies of the vaccine, and clearly 16 to 18-year-olds, those sitting for the HSC, aren't able to take any other vaccine at this stage, and so that's why we have a targeted approach there. But we'll follow the health advice as to which category of people should get what vaccine. But both vaccines are very effective. Both vaccines have stopped people dying. Both vaccines have stopped people going into hospital. So I just urge people to come forward and get vaccinated. But we take advice from our health experts. But clearly a priority for us, as Dr. Chant says to us almost on a daily basis, is making sure that mobile people, those who are authorised workers in those areas of concern where there's high rates of virus, are getting the vaccine. And we are trying to do that as quickly as we can. but we've had supply issues obviously, but there are now more points of access, more direct offers to go to where the community is in addition to our mass vaccination hubs, and we're keen of course to have that targeted strategy continue. Thank you. Last question. I'm sorry?
You keep promising freedoms from August 29th. So does that mean some office workers can go back in the office? Does that mean groups of more than 2 outside? Like, can you give us some more tangible details of what that's going to look like?
Yeah, I was asked a similar question yesterday, and that will really depend on where the case numbers are at and what the health advice is. But clearly, what Dr. Chant looks at and what the health experts look at is not only the rates of vaccination, but where those vaccination rates are. Some suburbs have nearly 100% vaccination. But if the virus isn't circulating in that community, obviously we're keen to make sure that we reduce the spread and increase vaccination in those communities that are especially vulnerable with the virus, and want to make sure that that's a priority.
And you also said yesterday you can't segregate, so it has to be a blanket.
You already had a question. I might ask Dr. Chant to say the last one.
Can you update us on how many children are in hospital with COVID? And given that we're a couple months into this Delta outbreak, looking back on it, can you tell us how this strain in particular, this variant, is impacting children more than previous ones?
Certainly we've seen more children infected, and we've seen some very young children in ICU, the later teens. And we're seeing children contribute to transmission, so we're seeing more childcare centre outbreaks. And that children are actually spreading it in those outbreaks. That's different from what we observed with the previous alpha strains. So clearly, children are more infective, and that poses additional risks for us in terms of how we do that safely, and that's why we've also asked people to bear that in mind in relation to their childcare arrangements.
So do you know how many children are in hospital
We'll
right
be
now?
able to give you that information, and that will be in our EPI report, and we will be able to give you the information in terms of children and its impact. We're tracking it very closely because we want to also confirm that the profile of the Delta is more severe than others. And that's, can I just leave that on my final message then? Please get vaccinated. We have access to very effective vaccines. Please get vaccinated.
Can I just say one more thing for Chris O'Keefe? One of the other issues around the aged care, which you asked about, is that it's the same for health, but the issue is that the aged care, I know the Prime Minister is now saying that they don't support mandatory vaccinations, but in aged care they want it. And one of the issues that we have at the moment that the bureaucracies are talking to each other about in New South Wales is who's going to be responsible to back in aged care facilities if they don't have enough staff to actually operate. So, for example, in the one that we had recently, Hardy at Summer Hill, there were no capacity in the end for that to be run except by New South Wales health staff. We had to put the health staff in there to actually keep that facility working to the point that people were looked after and transferred out. So before that order is signed, those issues have to be resolved as to are they going to have enough staff if X number of staff walk away from aged care. And that at this point remains a moot point.
They don't want the vaccine, or because they get sick from the vaccine, or what?
No, it's because of the reluctance to have the vaccine.
What proportion of aged care workers would be reluctant to get a vaccine?
Well, that's the issue. Aged care, it's not our area, but we know what we're being told is that it may prove very difficult for a number of the aged care facilities to stay open. So it's a balancing act which the federal government has to sort out because they regulate the aged care. But of course, when that's sorted,
They shouldn't be working in aged care if they want to get a vaccine.
I agree. My own view is if you want to work in aged care or health, you should be vaccinated. Absolutely. And I think National Cabinet have reached that stage, but they also haven't. The individual federal government issues haven't been sorted out to the point where we can actually be sure that those aged care facilities will be able to stay open. Yeah, that's the issue. Thank you. So I better go. Sorry. Tomorrow. I'll come back.